I'd like to call to order the Kingman Unified School District Governing Board Budget Workshop to be held now on March 5th, 2025. Can we all rise for the Pledge of Allegiance? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item 3 is roll call. Lori Grant here.
Susan Collins here.
Boyd Hardy here.
Wonderful. And we have absent Tony Henry and Roger Cox, but we do have a quorum. Item 4 is a review of the fiscal year 2026 projected budget strategic plan and the health benefits update.
Vice President Grant, Board Member Collins, Board Member Hardy, and members of the audience. We'd also like to welcome Chuck from ASBE. Thank you for coming to the FY26 budget workshop. Today, the workshop goals, I'm trying, will be to review district strategic priorities, just a general overview to remind you what guides us in our planning and thinking. Follow that with a school district financial risk analysis. That's information that Director Jones and I have recently met with the Auditor General to discuss. We will look at sources of funding and allowable expenses as a reminder for our planning purposes. Outline the FY24 revenues and expenditures, and then compare the first half of fiscal year 24 with the first half of fiscal year 25. Very similar to what we did in last February's workshop. Then we will look at the impact of student enrollment on budget, followed by a review of the FY25 revenues and expenditures to date, and then initiate a discussion of financial proposals for FY26 based on enrollment, staffing, revenue trends, and priorities. We also are going to invite a conversation on our healthcare provider and plan. All right. So I think first I'll do just super quickly the strategic plan priorities. We'll stay on this same slide. Just as a reminder, we've been very focused on these priorities again this year, the staff and student well-being. I just want to give you an update on some of the town hall initiatives from last October. I'd like to introduce Jennifer behind you. We have Jennifer. She is our benefits and wellness coordinator. It was prior to last fall a half-time position, and based on the input from staff, students, parents, and the community, we've increased our efforts for well-being. So she's with us in that capacity. We also have communication and collaboration strategies that have occurred, about the student town halls, and we've recently had a COLA, an online student town hall, so that we could get the perspective of students who have left the bricks and mortar schools and moved into the online schools. Under accessible learning environments, our Reimagine High School initiatives are underway. We're very excited that you voted at the last board meeting about the early college. There are other initiatives that you'll be hearing about as we move through the end of this year. And then finally, the effective and transparent transitions. Part of our transition plan that kind of overlaps with the communication would be our career exploration. That came from Town Hall 2, that our community, our parents, and our students want full exposure to pathways and potential career and college and military options. So we've alongside William Pottenberg and some of our other district team members really focused on that. So some of that you'll see embedded in the conversations and the budgets going forward. At this point, I will hand it over to Director Jones, and she'll take us through all the numbers.
The fun part, you guys. So a lot of work was done in FY24 to balance and reconcile our records. We worked with several different consultants, representatives from the Auditor General's office for corrective action plans and correcting accounting going forward, and with our auditors who have identified different mistakes for correction. So I knew back in October when the FY24 annual financial report, or the AFR, was due, we would have to revise it to account for all the reconciliation work that had been continually going on. So the AFR from October fed into this high-risk status and the two measures from the Auditor General School District Financial Risk Analysis in January 2025. And the two bottom ones, the financial position for general fund operating margin ratio and change in fund balance. The numbers here do not represent our current position. So I'm working right now on revising the AFR, but this won't get updated until next year. Unfortunately, it stays how it is. So we're also high risk, the top left corner there, high risk because of our reduced student count from last year, which we've been discussing at length, and we're working on ways to compensate for that loss in revenue. And Dr. Dorner will review that more in a few minutes. Also if you remember, during the December budget revision, we discussed our compliance status and passing the Auditor General's corrective action plan. Our district was on the Arizona State Board of Education's board meeting agenda on January 27th, and we were approved to be determined compliant with the USFR and have our non-compliance withholding returned back to us. So that's great news. Right now we were wrapping up the audit for FY24 as well, and while we're still in a learning period, we think we'll maintain our compliance status. If there are any corrections or additional corrective action plans that result from this audit, we know we'll be able to complete them, make the corrections needed in the time period allotted. Okay, any questions? Great. So we will not review every single number here. This is a snapshot of all of the revenue and then some of the expenditures in M&O and capital for FY24. Most of our revenue came from the state. We receive additional funding from Prop 123, which was a ballot measure that used funding from the Arizona State Land Trust Fund. This funding is ending, so you'll see that later when we do a comparison between the two. Let me see. These revenues here also include any carryover from previous years, and overall you'll see our total revenue of over $65 million is more than our total expenditures of $54 million, which gives us another nice carryover going into FY25. We also have other revenues and a few other funds of just over $13 million on the right-hand side, like the Classroom Site Fund, Instructional Improvement Fund, which we'll go into just a little bit more in a minute. This is not an exhaustive list of all other funds and revenues, and in the next, oh yeah, I said that. One interesting thing, this is not all of our revenues. We also, our total revenues for FY24 in M&O, capital, grants, ESSER, if we sell any property, kids doing fundraisers, we rent out some of our facilities to different organizations in the community. Altogether, $102 million was brought in over all funds and fundraisers, everything else. Overall, we've spent almost $90 million of that.
And I just want to add a caution, anybody that's either watching online or you're looking at the sheet on here. When you look at the total revenue of 65 and the expenditure of 54, you can't get too excited, because a large portion of that is, remember when we brought Margot on board and we were reconciling the prior financial situation, a large carryover was discovered from that clerical error, which is why our at-risk is going to improve. And so you'll want to pay attention when Director Jones is telling you what we're actually bringing in monthly to what we're actually spending. So we do have a reserve based on us correcting that situation, but you're going to watch it shrink here in a minute. If anybody's out there spending this money, don't.
What does restricted versus unrestricted mean again?
Restricted means that there's rules. It's restricted to how that fund, like the Classroom Site Fund, it is only for teachers, and actually, I will go to this slide. So the Classroom Site Fund, that's a restricted fund. That means there's very certain rules and regulations on how you can use it. Most are restricted. The one that was not restricted was the Medicaid reimbursements. That can be used for anything that you could pay out of M&O. So some of these, the Classroom Site Fund, it's used to support our teacher compensation. We've paid out longevity stipends out of the Instructional Improvement Fund. Our title grants, early literacy, and IDEA support disadvantaged students, at-risk populations, and students with disabilities. JTED helps support our CTE high school courses by funding special projects and CTE teacher salaries. And E-rate helps support our communications connectivity. And then Medicaid helps fund a few positions that support students on IEPs. That's our main use for that one.
Another way, Vice President Grant, we like to look at this is through the perspective of upgraded funding. So Classroom Site Fund kind of sits off to the side. That's all for teachers. It goes out to the teachers, but all the others are braided. For example, the IDEA that brings in 1.776 million, we actually spend on special ed upwards of 10 million. And so it doesn't fully fund the IDEA, but it does supplement it. The same thing with E-rate. It doesn't fully fund everything that happens in IT, but it does help. So.
Another great revenue source we have from the state is the building renewal grant, and this helps cover costs for repairs, renovations, or upgrading systems to maintain the adequacy of school facilities. We cannot use this fund for just basic remodeling, personal preference, or beautification. Last year, we replaced a boiler, gym bleachers, a repaired water leak, and we also started the Mount Tipton weatherization assessment and design. This year, the Mount Tipton roof was complete, and then we have several more projects in the queue that have been allocated money from the state pending completion. So between last year, the amount we've been reimbursed, this year reimbursed, and the projects that we have in the queue that have been allocated funds is a total of $4.5 million, which is amazing, because if you look at this list, you have the bleachers and the gym flooring, they're not necessary, but the
Kind of are.
well, kind of, but if you do without, you can do without, but chillers and boilers and a roof, you have to have that. We have to take care of those things, and that would be millions of dollars alone that we would have to find somewhere, either our carryover or other expenditure reductions. So,
and I'm going to just pause and give a shout out to our whole team, and specifically Michelle Cook, who is in the finance department, and Margot Jones, and some of the team members before Margot came in. When I arrived as the superintendent a few years back, we had a zero. We were getting $0 from the school facility board. Mm-hmm. As a matter of fact, I had an interaction with the legislator who was from here, and she said, "Why are you not doing this?" And so it took a bit of work to get the engine going on that, and I just have to applaud their efforts, because there's always something in the queue now. Our number one question is, does it meet
the criteria?
And if it does, we're going to try to go that way.
Mm-hmm. Yeah.
And they've even learned it's a very slow moving process, extraordinarily. There are so many layers in the school facility board and so many approvers that it's slow, but our team has learned how to fast track emergencies, mm-hmm. And really have a handle on it. So I just want to reiterate what Director Jones said. $4.5 million that would have otherwise needed to come out of our M&O, that isn't. So hats off to you.
Can I just ask a clarifying? Yes. Is there an extra zero, or is the comma shifted in the wrong direction?
No, there's an extra zero.
Okay.
Yeah.
That's a school teacher for you.
Yeah.
I love it.
You can't, it's who I am.
It's $1 billion.
That's right.
I mean, I'd rather have 18 million than 1,000,008, but.
No.
So when it comes to that, the year-to-date for the fiscal 25, 187, is that how much the roof costs, or is that how much every one of those projects in total is currently going to run us?
So I believe that was the amount we received back for the roof. Most of it was the roof. Mm-hmm. I think some of it may have been for the temporary chiller we had at KMS. I think we got some reimbursements already on that. But the roof was...
It was a $2 million project.
Yeah, it was huge.
Okay. So the rest of the $4,500,000,
the rest
so
of those,
3.2 or whatever it is, that's for the other stuff that we have potentially waiting.
Yep, that it's being held for us for these projects.
And so like last year, did you learn how to expedite with the Kingman High School water leak, and did they cover like a lot of that with the breaking up the concrete and following the pipes and,
Yeah, I wasn't here for
Yes.
that. Yeah.
Mhm.
And a few other projects we're trying, we're looking at getting into the building renewal grant is the Surbat roof, the Wallapai weatherization and roof, and repaving parking lots for adjacent ways. So a lot of more projects that we can try to get funding for.
Yeah. And the next stage is to become one of the Maricopa folks, because, and I don't mean to minimize our Maricopa friends, we have one here. But there's a lot of money that flows through, there's a large population in Maricopa, and sometimes the outlying areas have a harder time breaking into the system because they have lobbyists and they have people that are down there, you know, at the board meetings. So we're gonna start attending the board meetings. While we're doing well, we think we can do even better.
We
So
can.
we're gonna infiltrate the inner circle.
I'll volunteer to go to a board
Okay.
meeting.
Yeah.
So again, I won't go through every single number on here, but this slide shows the different revenue sources again, personal property tax, county, state equalization, and compares our revenue and expenditures from the first half of FY24 to the first half of this current year. So you'll see our revenue has gone down a little bit by $1.5 million. You're looking at the blue line. And then, so again, we've talked about how our reduced student count this year has led to a reduction of revenue. Some of our other funds, that's also been reduced. I mentioned Prop 123 has been reduced by about 3/4 this year. It will be on the November ballot for an extension for that.
Can Shelley give us any insight on what grants might be looking like?
So we're still kind of in limbo. Typically, our grant applications open March 1st, but ADE does not have any word on what the federal government will allow for grants. So they have postponed it to tentatively April 1st. So at this time, we don't know what we're getting, but we know all the different federal grants, the tens of millions of dollars that we had up there, they're all under review to make sure that they follow the federal policy that's in place. So we're kind of, we know we're going to receive money. We just really are not sure how much.
So really, if you look at the blue line and the red line, the totals, last year our total revenue was about 32.5 million with our expenditures at 26.6. This year you'll see our revenue's gone down and our expenditures have gone up. So overall, the expenditures are more than I'd really like to see right now. But again, this was forecasted by Dr. Dorner last year as ESSER funding ended, so we absorbed some of those positions into M&O. We also gave 3.7 raise. So we will, if you'll see in the M&O column, it looks like our expenditures are a little bit more than revenue, so I'll continue to monitor this and move money if we need to between M&O and capital to make sure we don't end up with a deficit, if possible.
I'm sorry.
You go ahead. Yeah.
Is that right? $67.21?
Yeah.
To 65,000?
Yeah, that's what
Well,
I'm kind of
I mean,
wondering.
that's not a typo, is it? I'm hoping it is.
No, it's not a typo, but I
happened?
think it's a possible, and I probably should have looked more into it. I think not everything was allocated correctly last year. I wasn't the one doing it all.
Okay. What about the county equalization also? There's a huge change
Huge.
from 34,000 to 1,675.
And that could have been the same. So in July of this year, we went back to under the county's umbrella, and they are the ones who give me a revenue report, and they tell me how to divvy all the money between these funds. So I'm following their guidance in FY25. I don't know how everything was allocated between the funds last year.
Right, and there were, the prior finance director, a lot of, because where Margot pulls the funds or these numbers from are from our visions database. And you have to input into visions to be able to output from visions. And the prior finance director, when I did the board workshop last year, there was some discrepancies on when she had deposited funds and when they had journaled funds in. So for example, and I don't know if this explains the capital, but she had not made any deposits, the prior director, into the capital fund the whole of the year that she was here until like April or May. So last year we saw zeros in capital for the first half, and then it all was dumped in at the end. So there could be some of that.
There was some, and she left mid-year, and then we had help. We had consultants helping us, and so there were so many hands in FY24 that it looks wonky.
It might be a date issue is what I'm saying.
Now, does that apply to a bunch? Because I'm noticing state equalization, $6 million, that's kind of a weird one. Other funds, 1.4 to 615.
So the other funds, that's the Prop 123. That's because there were more funds in Prop 123 and other funds in FY24. That has been reduced by about 3/4. So that accounts for the other funds. Last year in other funds as well, we used to charge tuition for high school students to districts who did not have high schools. And instead of charging tuition, we now just receive the ADM for those high school students. So at least in other, there's explanations. In some of the others, I think it's an allocation issue, that now I'm following the county's guidelines of how to allocate, whereas last year and previous years, I feel like there may not have been a rhyme or reason to how things were allocated.
Thank you.
So the extra $3 million makes sense? For
That's an
state
expenditure.
equalization?
Oh. I would have to pull everything from last year to know if it made sense or not.
Oh.
I don't have an answer for that, sorry.
You can pull it and
No,
get back to
that's
her.
okay. It's
Yeah.
just big number changes, so I was just curious, what triggers that?
Well, in the reporting that I get from the county, it makes a lot of sense. It's very easy to see. I don't know how it was reported previously, or how we even received the information that that's the money that we received.
But you know the bottom line is correct.
I know the bottom line is correct, yes. Okay.
So this is how enrollment impacts revenue. It's very similar to what I shared with you last year. Red represents a deficit and green represents growth. You have two perspectives to look at. I pulled numbers February 19 of 2024 and February 19 of 2025. So day to day, a year later. We're looking kindergarten to kindergarten and then kindergarten to first, for example, straight across and then longitudinally. So you can see, if you recall, we were about 100 kindergarteners down, 24 to 23. We've recaptured about 43 of them. So that's good news that kindergarten grew this year. Well, it's just a reminder that kindergarten is a half-funded grade level, so the 43 is really 21 and a half funded students, extra students. So 548 current kindergartners. And then first grade, you can see where we're losing a little bit, and I do have, some explanations for some of it. 585 to 469, that's a pretty large deficit in first grade. A minus 19 in the second grade is inconsequential, but third grade 60 down from one year to the next is pretty large. You can see though that the third grade in 2024, as fourth graders, they've gained. You can see that fifth grade that moved into sixth grade this year has gained. And you can see three of the high school grades gained this year. So there's growth in some grades and loss in others, but the bottom line is, based on February 19th's enrollment, on an unweighted funding basis, that's about a negative 1.1 million. If I just did a straight, basically $5,000 per student, it's like 5,013 is the base. But then you have to account for the weighting, and that's where you have to dig in to see who the actual students are. Is it a student that has a specific learning disability, or a hearing impaired student, or a K-3 early literacy student? And then see month to month when they enrolled and when they withdrew. So the weighted amount increases to a deficit of about $1.7 million when you add the weights in. And this, I projected a lot of this last year too, is not that there aren't students in our community, but the empowerment scholarship is still affecting us at a pretty significant rate. Not so much at the high school level. Our total high school enrollment is still over 2,000, between 2,100 and 2,200 kids when you look at the 3 campuses. But our online campus has increased to 457 kids as of yesterday. So a lot of high school kids are asking or seeking a more flexible schedule. They like the online option. So we learned a lot during those town halls that I've reported to you at the board meetings, and that's where our hybrid and our flexible schedules and our reimagining high school is coming in. Kind of looking at the face of education and how it's changing and addressing that at the high school level. A lot of those like 1st, 2nd, and 3rd grade kiddos, there's a plethora of ESA micro schools in our area, dozens at this point, where anybody can kind of hang a shingle out and say, bring me your little people and I'll watch them and I'll get a check from the state. Some of them are excellent. I know some people personally who are doing it and probably doing a fantastic job. But just as many are not. And we have evidence in many cases. Shelley has been in some meetings, and I won't go into the details, where it's clearly a funding gain for the person who's charging it. So our concern is not that we oppose family choice, but we oppose choice when the student is put in an educationally neglectful situation. And we know that won't happen in our district. So we're really working hard on the marketing and the communication of what we offer in the district. And then under construction are some ways to work with those homeschool families, like a homeschool academy, and coming down to the lower levels and meeting parents where they are. For example, not all elementary parents want their kids in school all day for specials and lunches and recesses. How can we use our instructional time model to kind of meet them where they're at and have an option where we provide the instruction, right, from highly qualified professionals, and then the work-based learning or the project-based learning is more independent. So lots of things going into this, but what you need to know for the budget is we have to start looking for a $1.7 million, even though we have reserve, and we're not going to go crazy with cuts because we have reserve. You don't want to count on your reserve year to year because it's going to run out. So we have to make our adjustments and live within our means, use our reserves for longevity stipends or other things that are not needed for sustainability. So we have held with the schools the last 2 days. Well, we had preliminary staffing meetings before the winter break. And in the last 2 days with the schools that are going to be impacted by staffing changes, we've met with them. We're looking at a reduction of 3 to 4 leadership roles and 15 to 20 teaching roles, and then other support positions across the district. Everybody's working hard. We've stayed at the schools. I'm proud to say, and we may have to use some of our reserves, but we are committed to this. We had reduced our class size at the high school, middle school, and elementary, upper and lower elementaries, remember, from 34 to 32, and then 32 to 30, and 30 to 27, and 27 and 25. As you go down, we've maintained those staffing ratios. So we're not increasing class sizes, but we are right sizing. So we looked at all schools, teachers and grade levels, the ratio that they have per student, per grade level, and per class. And we are reducing staff where there are ratios of 15, 18, 20, 22, and we can collapse some sections. And then we're looking at a matrix based on the number of students you have in a school. 0 to 300, there's usually 1 administrator and maybe a support administrator or other support roles. Between 3 and 600, there'd be 2. If you have up to 900 kids, 3 administrators. And so if we've had to right size administrative staff based on the number of schools. For example, both high schools will probably be going down an administrator because a lot of their kids have moved over to the online. So that's under construction. You, at the April board meeting, will give you those final numbers and what that means as far as savings. I'm going to ask Angela to explain, Director Moreski, if a school has fewer resignations than the number of reduced positions, what happens? So if there's 30 teachers and administrators total, and we need a reduction of 3 on that campus, but nobody resigns, what happens?
Right, so attrition is always the first step. Hopefully we can achieve it through that, but if not, principals are going to start having conversations with staff members who may be impacted. At-will notices and employment contracts are scheduled to come out on March 25th. We might hold some of those back and bring forward some either non-renewal, a non-renewal list to you for the April board meeting, depending on where we're at with those. We are recommending for a reduction in force, and so that would be the procedure that we would follow.
So several schools have no reductions. Most schools just have a few. It looks like a lot when you aggregate the number, but it's a sprinkling across all of the campuses.
I do have one question. Are staff going to be given the opportunity to transfer to another campus that would have an opening and maintain their,
Absolutely.
longevity with the district?
Yes, thank you for asking that question. Most definitely, and we had a few reductions in force last year, and it was gratifying to see that a lot of those folks were offered employment at other schools or different positions, and so they were able to continue their employment in the coming school year. So if that happens, if they're not offered a contract or at-will notice initially, but they are offered a position later, we just offer them that notice or contract at that point, and then there's no break in service because they're still finishing out the year before they go into the new position.
Okay.
With 900 employees typically and 350 teachers, 350 to 400 certified, we typically have attrition of 40 teachers on a low year, 50, 60 on an average year. So that's well above what we're looking at. I think the only time it would be super impactful is if they're a specifically certified person. It kind of happens a little bit at the high school level. If you're specifically certified for a CTE position, or you're an English person and all the English stuff is coming back, that's where it would get a little tricky, but HR works with them very well. We rarely have to literally riff.
And there are board policies that go through what that looks like too, as far as what things we consider when we're in a position, and teacher tenure and seniority are actually not considerations in that, and that's per Arizona statute.
Okay.
So that's for teachers in terms of the classes are full, we shift it around. How is it decided for who is let go or asked to resign or whatever for office workers and things like that? How is that determined? Because they don't have it.
Right.
Absolutely. So it is in policy GBQA. It talks about things that we can consider when making those decisions are the qualifications of staff members to accomplish the district's program, overall experience, training, and ability, past contributions to the program of the district, and any other factors being equal length of service in the district.
So seniority in terms of where like a office worker would be, you'd start at the bottom for the newest hires and work your way through. Is that how that would be determined?
I think that the primary criteria would be performance and their contributions to the district's or the school's mission. And that would be kind of the number one in the policy, just their qualifications to accomplish the program and the overall experience that they bring. So that could be time with the district, or it might not be. It could be with another employer as well.
In the way we hold the meetings with the principals, the district doesn't make the decisions. We just walk alongside the principals, giving them the data. We don't go and pick, you know, the people. Unfortunately, it's often position related, and then the principals who know their staffs the best would be the decision maker on. We say this is the number of staff you have, and then they work through their process on where those positions are placed and who's in them.
And when is that going to happen?
Right now.
Is it in progress?
It's in progress, yeah.
Do we ever look at like how many students we lose from 9th grade to 12th grade and like present it out to the public? So like it would have to go back to 2022 to see the 9th grade enrolled students and compare it to February 19th, 2025 as seniors. You see what I'm saying? Or do we ever look back at like how many kindergartners came in 13 years ago, and do we still have them, whether they kind of came and went throughout the years or not?
I'm going to defer to assessment, because you do a little bit of that, don't you, Lisa? Longitudinal, or is it mostly just year to year?
Mostly year to year.
Mostly year to year. I've gone back multiple years, but not by student name, solely by numbers.
Oh, no, I was just thinking numbers, like big
Yeah.
numbers.
Yeah, I can give you a report for
I was just curious.
maybe our current set all the way back for 12 years. I could totally give you that.
Is there any funding, either at the state, federal, county, to mentor these micro schools? Like if we did decide to do a workshop to teach them how to teach?
That's funny. Now, I'm going to give a brand new idea right in public on a streaming video. Haven't even told my team this idea yet. Liz and Lisa, hang on, because I think you're right. When I consider, you know, there's a lot of families, and we want to respect their choices, and of course we think we're doing a stellar job, and we'd like to have them with us. But I would love to offer in kind assessment tracking of those kiddos. So like if you're a mom, a parent, a grandparent, whoever, that has your kids in a micro school, because there are no boundaries or parameters in the micros, or they're none. They don't even have to assess them. You're just flying blind, right, and hoping they're learning. So I thought if we offered pit stops along the way, where we literally had a day where we said, bring your kids to KUSD district office, we could use our resources to give some measurements and assessments, and then give them almost a progress report on how they're doing. That would be beneficial for us and for the family. You know, there's part of me that says, well, we just want them in our school, and then the educator heart says, we need to know they're all doing well. And so that would be information, for example, if Susan had 4 little kiddos and she had them in a micro school, and we brought them in and we said, oh, they're 2-3 grade levels behind, then that gives her information to have a conversation, you know, with her support network on, this might not be working.
Yeah.
And it's not summative, and it's not sent to the state. It'd be non-judgmental, informative information to give them. And honestly, if that helps the micro schools too, that helps us, because they're going to come back eventually.
So part of our federal.
So there's the hot off the press.
Is we do partner with private schools in the
Yeah.
area
Yeah.
and offer training if they choose to be part of our equitable services. We do currently have 2. Next year, we're going to have 5 private schools that we will support to help them. We also, with our preschool, every preschool in the area, Head Starts, Little Eagle, anyone who has a preschool student, if they are teaching preschool, we are offering training to help them prepare the kids coming into kindergarten.
Awesome.
As a service, which is a requirement of our Title I.
And then you mentioned possibly looking at doing almost a hybrid for the littles. And so how would the funding for like the head in the chair work if they were only attending like a half day?
That's called our instructional time model, and Director Alvin would love to tell you about
But that would still apply even at
Yes.
Please say the question one more time. I'm sorry, I was writing down some notes about the assessments.
How, when you have a student part-time, even at elementary, let's say, part-time at school learning and then part-time at home in the ITM, how is funding?
So the funding would work by, it's really, we would take attendance based on whether or not the student completed assignments that were given to them for that day, and we would just take attendance, and the way it gets reported to the state is it would show if they're distance learning or not for a certain time of the day. And then funding is funded at 100% even with the instructional time on.
Yeah. If they don't turn the projects in, we lose funding. And it's just like with the early college and the HOP that we're doing at the high schools, the students, to be accepted into the ITM, the HOP or the early college, they've got to show that they are going to be autonomous at a certain amount of the time and produce the work. And if they can't, we would encourage them to not be on the ITM or the HOP and be with us all day.
So would the micro school lose that money then?
Well, they would if we enrolled them in KUSD as like I don't know, the title could be Homeschool Academy, where we are literally providing hybrid, like we do at the high school, only at an elementary level.
Okay.
Then they would be ours and not the micro
Gotcha.
schools. And the benefit to that is because we want to know how they're doing, provide the instruction, measure it, and know that they're on a pathway to learning.
Okay, that's all I have.
We're kind of excited about all the evolution of education. We're determined not to be nervous about it, but to respond appropriately.
All right, any other questions on this one?
Just one very small clarifying question.
Okay.
Our students that are online are funded at 100%, they're not funded?
They're funded at 95%.
Okay.
And we don't receive funding based on membership. So in all the schools except our AOI, it's enrollment. It's uploaded reports from our student information system on who's enrolled at that time. But for the AOI, it's based on the minutes that they or their parents attest to. They have to have a certain number of minutes working in classes online, and if they do not attest to those minutes, even if they were doing them, we lose funding. So we lost, based on a lack of attestation of minutes, upwards of $500,000. So we are reconfiguring the expectation for online. Part of our Reimagine High School is not closing our AOI, but funneling some of them that want more of a hybrid back to the main campus. Because if they're enrolled at Lee Williamson Kingman High, and they use the instructional time model and do an online course, but they're an enrolled Kingman High or Lee Williams student, then it's their membership. If they're purely a COLA student, it's 95%, and we have to have them attest. So we've had meetings, a lot of meetings with COLA, and we're training them on how important that attestation is. And if families aren't willing to or won't, then they're not going to be allowed to be in COLA. They're going to have to be in the bricks and mortar school to recoup the funding. And everybody's on board with that. What a great question.
Thank you. Thank you.
Can I ask a question there on that one?
Yes.
Since it is a budget thing, workshop. What about kids that, remember before we used to have where kids could go to a teacher and do an independent study?
Yes.
And cover a course?
Yep.
So instead of being COLA, they would be
Yep.
independent through teacher X
Yes.
for this course. We
Yes.
don't do that anymore.
We do on occasion do that. Yeah, if we don't have enough students, Mr. Bear, like Global Perspectives would be an example. If there's 10 of them and we can't afford to give somebody a section on the high school campus for those 10 because they're the 30 or somewhere else, right? Then we have done independent study, and we can definitely look at that going forward.
Because I know we have kids that ask that question, and I said, we used to have it. It was well advertised, and now it's not.
Yeah, I mean, we don't advertise it well. I mean, at some point, if there were so many independent studies, then we would lose a teacher because they're not in the seats in the classroom. But if it's not offered or there's not enough kids, but we still want to give it the opportunity, we'll 100% do that. So if there's a course and an idea, email
No, these are
me.
kids that don't, just like our kids that are in Edmonton. They're there because maybe they
Yeah,
want to be a regular.
If the course is offered, we're not going to do an independent study.
Okay, that's what I meant.
Thank you for clarifying.
Yeah, no.
Yeah, if it's US history, A or B, and there's seats in that class and it's being taught and it's live, it'd be rare that we would do an independent study. If there were extenuating circumstances, case by case, we could talk about it. But if there was a creative writing class and 7 wanted it and we really didn't want to put them in a course they didn't want, we could do an independent study. We have a formula for that.
So a teacher could really make a course that would be
Yes.
kind of independent.
Yep.
Like history of movies in
Yep.
the 30s.
Absolutely.
Cover that as an elective.
Our goal is to have personalized and customized pathways for every student. So, I mean, there's lines.
Yeah.
We can't have 1,000
I figured
different,
that.
but yeah. Thank you, Mr. Bear. Mr. Seeker.
Can I ask just about a couple of numbers up there, because I'm just trying to figure it out. So like second grade, it says there's minus 19, but 562 to 557 is only 5.
Oh, I was looking at is 585 to 557 the 19?
It would
Yeah.
be 28.
Well, then you found an error, so thanks.
And so there are a couple others where I found, so I was trying to figure it out. So seventh grade, 503 to 586 says minus 8, but that would be plus 83.
Which one?
No,
Seventh
503 to 497.
Okay, so the column with the plus and minus is the grade, that cohort following from like 7th grade to 8th grade?
Well,
I get that, but the numbers don't line up there because they're straight across. 505 to 5848 at kindergarten is plus 43. Then at first grade, 585 to 469 is minus 116.
no, we did update it, so I'll check that we did.
So I'm just, there were 3 places where I couldn't figure out how the numbers worked, so well, there were 4 actually, so I was confused.
Okay, we'll double check that, Mr. Seeker.
Yeah, I get what he's saying, because at the beginning, it's
It's one, and then it goes to
straight
the other,
across,
yeah.
and then for some reason, at like 6th or 7th, all of a sudden, you guys are subtracting it from, you're taking the 7th grade numbers and subtracting it or moving it around from, I don't even know where. Because
Well,
They're
that'd
all
be
straight
me, not
across, but
Margot.
4 of them are different.
You can have this
Yeah.
mistake, I'll take the other one.
Okay.
Okay. We will keep going then. Okay, benefits. So we have been spending months and months researching and gathering quotes for new healthcare benefits, hoping to find better rates. One company I reached out to would not even give me a quote. They were about 30% higher than our current rates. Another broker came back with about a 25% increase. We looked into self-funding options as well, but decided as a district we're not quite ready for that option. So then I also received our renewal rates for next year from Kairos, our current administrator, and they came in at a 25% increase as well. I had a few discussions with Kairos regarding this increase. They knew that we were shopping for rates. So knowing this, they offered a slightly lower percentage if we entered into a multi-year contract. However, the increase would still be like 18 to 20% next year, and then I would have to promise to another 18 to 20% the year after that for this multi-year contract. We, as a district on our side, we spend over $6 million in benefits. A 25% increase would be $1.5 million. You've seen we don't have it. So ASBATE is another insurance trust like Kairos. It's a bigger pool. Their rates came in about average 6% decrease to our current rates with Kairos for healthcare. There's a slight increase for dental and vision. So altogether between the health, vision, dental, and life insurance that we offer, it's about a wash for us to current rates. With our other options, that's great. ASBATE is part of the Aetna network, and we're currently with United Healthcare. So I know a lot goes in to thinking of switching carriers, especially for those on recurring medications, chronic conditions. So we wanted to make sure we have this discussion. Chuck Nelson from ASBATE is also here to help answer any questions that we have. So a few of the differences that we can, so a few of the same benefits. ASBATE offers on-site biometrics, flu shot clinics, on-site mammography, and the employee assistance programs. A few of these differences, when we met with Chuck a couple weeks ago, we were all really excited about some of these. They have Virta Health, which is a wellness program to aid in weight loss and reversing type 2 diabetes. Hinge Health, which is a virtual physical therapy where they send you all the equipment and therapy plans for you to do physical therapy at home. And if I get anything incorrect, you can jump in and correct me on it.
No, you sound great.
And Skin.io is a virtual dermatology app where you can map and photograph any skin issues, and it's monitored by physicians, and they'll get you in to see a dermatologist within a couple of weeks if they notice anything. They also have Teladoc Primary 360, which is a virtual primary care with 24/7 support, which especially for us here in this rural community where we have a hard time finding primary care providers, that's a really great option. All of those are free, or included, I should say, included with our membership. You have any questions on any of these?
Yes.
Okay. I know, nurse practitioner Grant, what are your questions?
So for the virtual health,
Right.
are you covering the GLPs, and are you covering using the American Academy of Obesity's criteria for weight,
So-
or are you coming up with your own
So
criteria?
Verta doesn't actually cover the GLPs. The health plan does.
Do they?
Yeah, so the health plan is gonna cover your Manjaro or whatever you might be taking. There's a couple that, like Ozempic for sure is under the formulary
So they're covering them for diabetes.
for diabetes, but the ones for, even the ones for weight loss now, they'll cover those. However, the idea is, and the idea of bringing Verta Health in is to change the mindset. Once you start on a GLP-1, you will be on it for the rest of your life. Once you come off of, if you come off of that, you will gain almost all of that back. It's 99.9% of everybody gains either everything back or more. So Verta Health is like an off-ramp. So GLP-1s are fantastic. I mean, they are a miracle drug, you know, but you have to have that off-ramp. And through nutrition, through a physician, and through a coach, you change your mindset in regards to eating, right? And so it's healthier living, healthier attitude. And the thing is, I mean, if we can get folks, you know, the folks that are eligible for it are either diabetic, they're either pre-diabetic, or they're at a certain BMI where they want to lose weight, and they also, I'm considered obese. In fact, I think last week I was morbidly obese. So based on my weight, although hopefully I don't look like it. But
Jeans in the jacket.
So you mentioned based off of certain criteria.
oh yeah, absolutely, yeah. So it's like 25, your BMI has to be 25 or above if you just want it for weight loss, okay, for the Verta Health.
Okay.
So the Verta Health is a program to reverse type 2 diabetes. If you're overweight, you're heading that direction anyway. We're trying to help the folks that not only want to lose weight, but also the folks that are pre-diabetic and diabetic. We want to get them off insulin, we want to get them off medication, and we want to keep it from morphing into other,
Totally okay with
yeah,
lifestyle
morphing into
modification,
other,
all of that.
kidney disease or
But
anything
what
like that.
I'm worried about
heart
is the
disease.
prescription coverage, because
Right.
that seems to be where a lot of the financial dollars are coming from.
Yes, that-
And so if Aetna Choice is including everything, including your prescription coverage,
Mhm.
what does that look like compared to what we previously were offering our employees? Like, what is your cost for brand? How is that gonna change?
I think you're going to see a lot of similarities. So
Okay.
you've got generics that are
Sure.
$15 for generic. You're going to have like a $40 for brand, or up to a maximum. But if the brand is cheaper, it's going to be cheaper. I mean, by law, if a pharmacy has a brand name prescription and it's $35, you're not going to be charged $40 for it. You're going to be charged that $35. Does that make sense?
Sure.
Okay.
Well, the next page actually goes into.
Yeah, just that
So it
slightly
doesn't
goes
go over
into
to
it.
the prescription coverage. It's just. the-
So a little bit about ASBATE. ASBATE's been doing this since 1988. We are a health program for school districts that are run by school districts. Everybody on our board is a superintendent, business manager, board member, or HR director. Okay? So they all have a population of employees that they're making decisions on in regards to their health care. So when they make decisions regarding the direction of ASBATE and the future of ASBATE, they have skin in the game because they're affecting their population. So I always think that's a huge plus, because you're not missing out. you're making decisions that are gonna help folks, because if not, they're gonna hear it every single day that, oh my God, I can't believe you made this change on this program. When you look at deductibles, your Kairos deductible, what, is 500 and 750?
Yeah, do you want me to?
Yeah, you can go, yeah, so you've got a 750 deductible with Kairos, we're at $800. The thing is, though, with Kairos, your 750 deductible, if you have family, so you do 750 for +1, plus 750 for family, for 2 or more. We're at 800 and 1600, so you're only charged twice for a deductible. So one, you're saving there. It's an 80-20, which is the same as Kairos' plan. 5,100 is your out-of-pocket max. That means once you reach that $800 deductible, you pay 20% of the rest of the medical bill until you reach that 5,100. And again, you've already paid 800, so you're at, you know, what, $4,700 more at 20%. And then everything's paid for at 100% because you've met your out-of-pocket max. We can't charge you any more than that, so the insurance pays 100% of everything, okay? So all the plans are fairly similar. Your copay, I think, is a little bit higher, but then again, our deductible, when you look at the total of it, it's a little bit less expensive. At the same time, also think about it. If you've already used some of your deductible for this plan year, for January, like January, February, March, or all the way up to June, the employees are going to get a deductible credit. So if they've used $400 of their deductible, starting July 1, it does not reset. They are going to have that deductible credit. So it is going to benefit them, which is always a good thing. They're not going to be hurt by switching to a new plan as of July 1. Yes, sir.
Just a quick question, because Kairos on their premiums had individual plus spouse, individual plus children, individual plus family. We've not talked about premiums, we've just talked about plans where they're individual and family.
Right.
Is there a breakdown from you, or is it just individual and family?
Oh no, we have 4-tier. The rates are 4-tier.
Because the copay plan
The
does have a breakdown.
The deductibles are 2-tier, so it's again, it's individual and family.
Okay.
As opposed to individual plus 1 and family.
Okay.
Okay. But the premiums are going to be, if you've got, you know, if it's you and a
So
child.
individual plus children, individual family, individual spouse.
Right, exactly.
All the same.
Not a problem. I just wanted to make sure I was
Right.
reading it correctly.
Yeah.
And then I have a question for you, Margot, just real quick. So Kairos came back with their 25% increase, but were the plans staying the same as far as deductibles, out-of-pockets, or were those changing as well?
The only
Do you
thing
know?
with Kairos that would change is the 1,600 is going to a 1,650, and that's because I believe it's a federal mandate that it's going to
It is.
1,650.
It is.
So that would be the other change. Otherwise, everything else would be staying the same.
Okay.
And we don't have a 1,650. We have a 2,600. We had a 1,600, but we looked at our pool, and again, like I said, we've been doing this for 44 years. Our pool consists of about 19,000 Arizona school employees. When you look at the numbers, the majority of the folks that are in a high deductible health plan are in that 2,500 arena. So we said, well, you know, if the folks are going to use it, and we don't have as many people in that 1,600, let's just move that 2,600 into that is our lowest high deductible health plan to be able to be offered.
Yeah. So the high deductible plans, you can see what we currently have across the top and then the new ones, so that the high deductibles are more and the out-of-pockets with ASBE are also higher than what we currently have with Kairos. So the plans are not, the plans are not quite as good as what we have, but
Right.
when you
So-
compare that to the 25% increase, that's.
And I'll tell you what, I mean, no plans are going to be identical. You're going to have something better here, something better there. What we think it makes our plan a richer plan is the whole package. It's not just the biometrics, it's not just the mom bus, it's not just the flu shot clinics, that Verta Health. Again, steps are great. We love that people are counting steps. We want you to count steps. But we also want to change the future of your health for this district to make sure that you are not getting 25% rate increases. That is devastating. I mean, that is a huge increase. So Skin.io, again, is early detection of cancer. You know, you've got an app on your phone, you take a picture, goes to a dermatologist. If it's cancer, they will get you into the dermatologist right away. If you are hurt and you've got a back or neck injury, you can do physical therapy at home. That saves the employee a ton of money because every time you go to a physical therapist, you're paying a copay. And when I've gone to a physical therapist, they say, okay, hey, Chuck, you know what's going on? And then they show me the stretches or exercises they want me to do, and then they move on to the next patient, and then they say, okay, go over in that corner and do your exercises, and then they send you home with homework on stretches and exercises that you do at home. I would much rather have a coach online, have all the sensors on me, so they know that I'm moving my body the right way, and be able to rehabilitate myself that way, and save that copay. That employee, that's a lot of money. You know, it's not nickel and diming anymore. It's 25, 25, 25 every time you go. So it gets expensive. You know, again, we've got so many benefits that are kind of intertwined into it. The Teladoc 360, some folks love Teladoc. Some folks love their primary care physician, but they don't like to leave their house, or they don't have time to leave their house. You know, so you can get yourself a primary care physician under Teladoc. Now, you're still going to have to go get annual physicals, stuff like that, but if you just want somebody, you know, hey, I've got to check in, you know, and I need a script written for me or a refill or whatever it is, and you don't have to actually go in to see your doctor. They just refill your maintenance drugs.
Is our hospital a participating provider?
Yeah. Yep.
Is our, like, affiliated, like, imaging center and everything else?
Everything
that we have
Karen's
available? What about lab? Is it LabCorp Quest?
LabCorp.
LabCorp?
Yeah.
Okay.
It's a NorQuest.
It's NorQuest too. Yep. So we did a geo-access. When you look at your population, we had 99.89% of all your people were covered by primary care, a specialist, and a hospital. At least on the primary care and specialist, there was a hospital within 2 to 3 miles of each one of them. Okay? With hospitals, it's a little farther, it's like 4 to 6 miles. But you did have a couple outliers. That's that point, you know, when you were at 0.89, you had somebody from, was it Pennsylvania? With an address from,
Oh,
you have a couple folks that have addresses that are not Kingman.
Oh.
So when we ran the report,
Oh.
it skewed the numbers
Yeah.
just slightly.
And
But your coverage
Yeah.
is rich.
there's always a possibility that some of our smaller clinics in town may not accept Aetna.
And so the premiums are 5% less.
Than what you're paying
It's kind
now.
of, yeah, there's some variance. I think some of them were like at 4%, 6%, and then with vision and dental and life that are a little bit higher, it evens out between all of it,
And is that savings going to go to the employee or to the organization?
both.
So yeah, so I just want to iterate, because I told Marva this and she knows this, but I sat down and sort of calculated. It's those out-of-pockets on your HDHPs that are my biggest concern.
Mm-hmm.
If you compare the 2,500 HDHP from Kairos to the 2,600 from Asbate, the out-of-pocket increase is 117%. And on if you compare the 5,000 to the 6,000, the out-of-pocket increase is 32%. Those are big dollars for
They
someone
are.
that.
We're definitely saving money up front, and then the employee would be paying for it if they are using their plans on the higher end.
Right. So,
I'm not saying it's a bad idea, I'm just saying it's something to be.
So I have not seen Kairos's new plan designs. I was in 2 board meetings yesterday where they said that their out-of-pockets, their deductibles have changed. So I don't know.
Yeah. So I guess I haven't seen that either from Kairos yet.
Right, so,
I just got our
because
rate
you guys are not alone, at 25%, you're not alone, it's out there. Some of what's happening is Kairos is doing a reset because they came in so low and they've been trying to catch up year after year after year and they can't, right? And so now it's a reset where their average is 14%. That's a huge increase for an average. Our average this year was 3.7. That's our average increase for one of our clients. We have 50% of all the schools in Arizona are with ASBE.
So,
And probably, I would say, 15 of them have been with us for over 10 years, and I think we have 9 that have been over 15 years, right around there. So, you know, we have longevity with districts, we have longevity in the area. We're not going anywhere, and we're going to keep improving benefits, you know, whether it be out of pockets, whether it's be adding on benefits in regards to what's free for your employees, whether it's Verta Health, whether it's Hinge Health.
so on the HDHPs, are wellness visits covered at 100% with the
100%.
deductible waived?
Yes, yep, absolutely. And that's by law. Every plan out there, whether it's Blue Cross, whether it's Kairos, whether it's ASBE, preventative is covered at 100%.
Do we know what percentage of our employees have a high deductible plan and would be affected by this change?
The majority. So we have about almost 600 employees total on a plan. Only 36 of those employees are on the copay plan. The rest are sprinkled through all of the high deductibles.
Yeah.
So yes, the majority.
And just because as a single parent, single income household, I know when I was trying to when I was covering my kids through the district, I couldn't afford the district.
Which is what prompted us, the rates kept increasing with the increase last year. That's what prompted us to start trying to look for rates. And when nothing came back even close, except for ASBE, but that's the exchange there.
Yeah, you've got 318 folks on the 5,000.
Yeah.
You've got 120 on the 2,500, and you've got 109 based on our numbers on the 1,600.
Yeah.
So are you saying that those people that are on the 5,000 currently,
Yep,
that those are individuals or those families?
those are individuals. Well,
They're
yeah, those are,
both.
hold on, they're both. You've got 265 that are individuals, you've got 16 that are employee spouse, 14 that are employee children, 23 that are family.
And with the HDHP, is there if you go up to the higher deductible, is there an increase in the HSA contribution?
Yes.
But the HSAs are capped, that you can only get to a certain amount of money.
In total?
Yeah, you can only
every
put so
year you
much
can
into an
only-
HSA, they're capped by the federal government.
Well, per year,
Right.
but not in total.
Not in lifetime.
Right.
Correct, per year.
Yeah, because I like my HSA.
Yeah.
I like mine too, but my concern is, so if you look at the 2,600, so the individual out of pocket is $7,500. But I, being over 55, can add extra. I still can only put 5,000 into my HSA, which means I'm still on, even if I fully fund it, which is a lot of money coming out of my paycheck to fund it, I'm still short of my total out of pocket.
Do you hit your out-of-pocket every year?
I don't, which is why the HSA is good for me, and I'm not,
No,
I'm not
that's
arguing
great.
against your plan, because there are a lot of really good things
No,
about
and
it. I'm just
again,
saying,
I think
reality-wise, for
It's
employees, you
catastrophic.
just have to be cognizant of
Right.
what those values are gonna look like for somebody, and what that could really mean to their bottom line.
Absolutely.
Right, well, then you have to just discuss
yeah,
amongst
and
yourself, I
that's-
guess, you know, what that looks like in regards to, I mean, you've got a difference of 22%.
Right.
in
I
regards
love
to
a lot of
costs.
things
So
about your
I'm
plan, I
saying-
just want them to be
So if
aware of
someone's
how
gonna
much
go back
that's.
into the HSA,
Yeah.
again, the folks that have the higher deductible HSA, you give them a higher stipend.
And you're saying even with the high deductible plans, like the Teladoc and all of that is free?
Everything's, yeah. Well, Teledoc's free
Including-
for emergencies. Teledoc is free for emergencies. Teledoc is, if you're on the copay plan. If you're on a high deductible health plan, it is not free because there is a service fee, they call it, because the government will not allow you, under a high deductible health plan, to have first dollar coverage. So you have a $56 service fee
And that's
for your
not-
doctor visit.
That's how it is with Kairos as well. It's
Okay.
not free with our.
But if you've got the copay plan, it's either free for emergencies, if you're gonna do the 360 where you have a primary care and you see the same doctor every single call, $10 a visit instead of a $30 copay.
And so for the high deductibles, it'd be 50-something
It would be,
irregardless,
it'd be $56 for the service call,
whether it's for emergent, urgent care
Right, because-
or
right.
primary care?
even if it's primary.
Okay.
It's gonna be about the same. So you figure a doctor's visit is gonna be, you're looking at, $150 to $180 in regards to a regular doctor visit, but then you've got the network discount.
Is there other information that I can bring to you from Kairos? So we have to let Kairos know by the end of March if we are going to leave them, which means at the next board meeting next week, we would have to vote. I would have rates for you to look over, and how that would look with ASBA or Kairos if you want to see rates with Kairos as well, moving to the 25% increase with
I
them.
would like to see that, because I don't know what Kairos Club covers in terms of you guys. I mean, I don't know where the differences are to figure out, is it worth the individual, like, is Kairos, is there high deductibles, are they going up this year?
They're
I'm just
going-
trying to look, and I can't see anything that
The
says. it.
1,600 is going up to 1,650. I've been told the others are, the 24 and the 5,000 is staying the same. The individual out-of-pocket may be going up, but that I'm not sure on. But the high deductible is very, besides the 1,600 going up to 1,650, the rest are staying.
Right.
Um,
And I
so
only
it's-
brought that up because in my meeting yesterday, they have Kairos, and they said all that is going
Yeah.
up, so.
So that
I
I
can get
can,
copies.
that I can look, but with a 25%, even a 20% increase, if the district is looking at an increase of $1 million to 1.5, we would probably have to even cost share part of the district's portion more with the employee, which means even higher, which means it's not a 25% increase for the employee, it might be 35 or 40% for the employee, because the district just doesn't,
We don't have the
we don't
solvency
have it.
covered.
Yeah, and that's year after year, that's
Mhm.
next year, it's the year after, it's another $1 million or $1.5 million to the district, and we can't sustain that, so that would continue to be given to the employee as well. So either way, it's hard.
Right.
Either way, it's a hard decision that you pay really high premiums up front, but your coverage is a little bit better, or you pay less up front and your benefits are not as good.
Would it help? I know Kairos has already offered a 2-year, like a rate cap or whatever they were considering it. I think we talked a little bit about it.
We did.
Would it be something that we should discuss?
Yeah, I think we can discuss that as well, that I can present all of the information. Anything else that you guys want to know, I can try to get you anything before next week so that you have all of the information you need to be able to make that decision for the
Because
district.
we would be, if you wanted it in writing, we would be more at 8 as a cap. That would be the highest it would be for the second year.
Right.
So
Much
just
easier to budget.
because I don't understand insurance for the life of me. Why aren't you guys at 1,650 for individual?
We were. And we looked at our pool of 19,000 people, and we looked at the population that are on that $1,600 plan, and we looked at and said, okay, we've got a majority of folks are on that 2,500, so we're just merging those folks into that 2,600, because we don't have the population in a 1,600. People aren't electing it. Again, you've got 300 people out of 600 that are on plan, 50% of your people are in that $5,000 plan. So
It's also
they
the
want good
cheapest.
coverage.
Yeah.
They want
It's
good
the
coverage,
cheapest,
but
but
they
that's-
also want to have it affordable to them, especially if it's families.
So, and I'm just going to jump in one more time, because I know it sounded like I was against this, and I'm not. Okay, I just want you to understand that I really am
Yeah.
not. Because the other thing really to consider is the fact that with ASBATE, you get a bigger pool and you get more stability. And so that's the other thing to consider as you look long-term. I mean, do you know what I mean? I wanted to make sure that we're considering what that impact is gonna be on an individual basis. But as an insurance basis, and I've been doing insurance for school districts for 20 years, the size of the pool from ASBATE and the stability of ASBATE is really something to consider versus what's gonna happen with Kairos and the fact that you're getting 25% this year, but like she said, they can do a 2-year, but you're still gonna get 20% again the next year. That's something to consider because their ability to stabilize those numbers is not as big.
Right. It is a much smaller pool with Kairos, which is why I think we're seeing this. And I've also noticed with ASBATE, they just have more wellness-forward programs than
Yes.
Kairos.
They have some great
And
benefits
so I
in
think
there.
that is a huge benefit. Just the few that we've discussed tonight, that's way more than what we've had with Kairos. And I have nothing bad to say about Kairos. They've been great to work with. But
Yeah, I mean,
purely
they're
business
great.
decision.
I mean, Kairos is great.
You know,
I mean, they're all great, but it also, it has to be a great benefit. It has to be at an affordable price.
absolutely.
You know, and also you want that longevity of a price because, you know, because the biggest question Margot said to me when I first came out to present, why the heck are you guys so low? Are you just buying the business and the next year you're gonna be, you know, giving us a 15-20% rate increase, right? And we don't. I mean, we have actuaries that look at the numbers. When we run numbers, we look at all your claims, we look at all your premiums, we look at your large claim data, we look at all the RX. So we calculate everything into that, and we can come up with numbers that when we look at what our pool needs, that's where you fall. I mean, you're priced correctly where we're at right now. And that's why with the second year, I could always say, you know, I mean, again, 15-year average for ASBATE's renewal, our average was I think it's 6.3% for an average for 15 years. That's huge. But it's because of the population.
Yeah.
Like you said, it's a stable program. We're not going anywhere, we're gonna be here for another 41 years, and we're gonna keep innovating, offering more well-being or well-forward type programs because we want to get you healthy. You know, you can't medicate yourself to health. You medicate yourself to mask symptoms, and you want to be in a position where we can help as many people as we possibly can. That's what we're doing.
But before next week, I will have renewal rates with ASBATE, renewal rates with Kairos for you guys to look at. I can also send all of the information on more of the plans, the prescription plans, things like that. Everything that I have, I can send over. So if you want to look in and kind of compare, you can do that as well. And that way you can have an intelligent vote for next week and not just, you know,
Also, Margo,
flying off the handle.
if you get the updated Kairos benefit summaries, if you want to shoot them over, and we'll do a side-by-side.
Okay.
And then that way you've got it right there. Here's, you know,
Okay.
I'll even highlight the benefits for, okay, it's a benefit here, it's a benefit here, it's a benefit here, it's a benefit here. You know, so if you want to do that, I'd be more than happy to.
I'll see if I can get it. So
Excellent.
in time for us to be able to put all that together.
Yeah, when is your board meeting?
It's next Tuesday.
Next Tuesday.
Yeah.
Okay. I was gonna say, if you want me to come out and present or do anything, I would be more than happy to, but I'm gonna be in Nashville next Tuesday, so.
I think at that point, it'll just be a vote on the rates and I'll have that ready for you guys.
Okay.
There's gonna be no problem with people that have, that already have diagnosed illnesses or anything.
Pre-existing, no, yeah. You guys are under a group program. There's no pre-existing for group programs.
Oh, okay.
Sometimes there could be issues with medications when you're switching from one carrier to another. Sometimes the next carrier says, well, I know you're on this 3-tier medication, but we want to see you go through tier 1 and tier 2. So I want that to be clear. There could be interruptions in some medications.
Right.
Not that you're not going to get treated for it because it's pre-existing, but sometimes a new insurance company wants to see the history or they want to see more documentation that you have tried the cheaper pharmaceuticals before they will pay for that. So That
So
is
you're saying
absolutely a
that they're gonna
possibility.
tell them you can go back to the cheaper one that we know for a fact doesn't work, and then you get to go to the way up?
They
Or
could.
is it gonna be like,
They
here's the paperwork?
could. They
So,
could.
so what we would do is in the interim, while we're transitioning, we can get a list of, we can look at all your meds that everybody's taking, not single out anybody, just de-identify them. We can look at all the top medications, and we can do a prior authorization, so that way as of July 1, everything that needs to be is authorized, so that way you're not switching any of the main, if you're on Dupixent, we don't want you to change. We want Dupixent to be covered, okay? So we don't want that. It's, if you're taking,
Trust that.
You're taking-
You're gonna say drug, I
if
have
you're
no
taking
idea the name of it. It
Prozac,
doesn't matter.
and
I
they
just
wanna
need to know that
switch you to
people that have
Fluoxetine.
predetermined stuff.
right,
are gonna be
it's the
okay.
same thing, right?
Right.
So they would say, go for a generic, it's gonna be less money. So, but if you're taking a preferred brand name or even a specialty drug, they are not gonna, like if you've got cancer and you're taking capecitabine, they're not gonna, oh no, you gotta switch it. Sorry.
Okay.
Yeah,
that's-
so we'll get prior authorization as the transition. We start, I mean, literally, with spring break, right at the,
Next week.
is it next
Tomorrow.
week?
Yeah.
Okay, so then you come back from your board meeting, you come back from spring break, it's the end of March, we're already, based on what the decision is, possibly next week, we're already working on the onboarding, getting materials done, getting everything pushed together, and also requesting data that we need in regards to, again, like those medications, to make sure if there's anything that's that needs a prior authorization, that we have all that handled
Yeah.
prior to the July 1 launch.
Luckily, we do have enough time. We can get information out to employees so that they can search and look and see if their current doctors are on the plan, which I believe the majority of them should be. If there is any interruption, if their doctor is not with Aetna, then they would have time to make a switch if needed.
And keep in mind, so, and I know you probably know this, so if you go to a medical group, I go to a medical group, okay? And so they've got 15, 17 doctors, whatever it is. So I've got 3 doctors over here that are contracted with Blue Cross Blue Shield, United Healthcare. 3 of the other doctors are contracted with Aetna and United Healthcare. And then you've got 10 others that are contracted with Banner. If you're going to that clinic, you're gonna have coverage, but your specific doctor might not actually be contracted, although they run the paperwork through the clinic. So you have coverage. So I run into that all the time. Does that make sense?
I'm just glad I'm not doing insurance in my life.
It makes insurance sense.
I agree.
It makes insurance sense.
Yeah. It makes sense. Okay, well, I think I confused everybody there. But yeah, but you know, if you need to, just call your doctor. Hey, are you
Yeah.
contracted with Aetna?
And we do have enough time for the,
You know, and Aetna Choice is the largest network that Aetna has, because Aetna has a few different networks. Aetna Choice is the broad network. It covers you throughout the United States. It's got the most providers than anything else that Aetna has. So anyway.
Thank you. Thanks for the answer.
No, thank you all very much. I appreciate it. You know, if you want to give them my number or my email, whatever, and they have questions, they can just reach directly out to me if you want. So,
okay.
thank you.
Well, if we're good, we'll keep going. All right. We're almost there. So in summary, we are going to continue to monitor expenditures. Consideration for raises won't be decided until closer to the end of this fiscal year. If it's possible, we will bring it to probably the June board meeting. If raises are not possible at this time, we'll consider longevity stipends if the budget allows for that. We're also reevaluating the 301 money allotment for certified teachers, and more to come on that as the 301 committee meets to approve a new plan.
But we will say it's a significant increase, not a decrease.
Right, yes.
Don't want to give any scary, don't give any scary information. It's definitely going up,
yes.
not down.
And that comes from the Classroom Site Fund, not from M&O, so that's how we're able to do that, and maybe not raises, so that's how that works. Our weighted student count has decreased 341 from February of last year to February of this year. And that calculates to that $1.7 million that Dr. Dorner referenced
And
earlier.
I'll jump in and say that came from state reports, not that longitudinal study.
Yes, not
That
our
number is-
math.
So and I'll give you a refresh sheet on that, where some of them were 24 to 25 and some of them were not. But the 1.7 comes from the ADE's monthly reports on our student reductions.
Yes,
Not a math calculation error on a
right.
slide.
Can
Unfortunately.
I ask a clarifying question on 301?
Yes.
And I understand the reason for doing the 301 in lieu of raises, but that also means that that does not count toward retirement
It
for our
does.
teachers, correct?
It does. Their
It does.
W-2s count toward retirement, and that is on their W-2s.
Okay.
Sorry.
No, that's okay. I didn't.
No,
I-
then I'm glad I asked because that was something that
Yeah,
I
it's your
had-
annual income, right? And so your highest years are your W-2s, and that would be included in it.
Okay.
Yes.
You're smiling, am I wrong?
No, you are correct.
I know, I thought I was.
I'm
but then you were
smiling because when you don't raise base pay for people that are
Yeah.
at the younger
Right.
level, over the long term, that has a bigger impact on their earning,
It does.
because then you give 3%, but they didn't get a base this year, that 3%'s on a smaller figure, whereas if you're getting it's a
that's why
real
we're trying-
calculation
yeah.
piece. But that's why I was smiling, I was just thinking about,
And that's why we're trying to transition some of the funds into the base. That's what we'd been talking about last year, where we kind of had to separate it because we wanted them to, we gave the raise on the portion that was associated with the base.
Yes.
Associated with it, not on it, right? I'm looking at Angela.
I mean, our base pay is partly contracted salary, and then there's kind of two buckets of money, if you will, that are base pay that come out of the classroom site fund.
Right. And that was new last year for exactly the reason you just pointed out.
Okay.
We have an increase of expenditures of about $3 million from M&O and capital, which includes the raises from last year, energy cost increases, ESSER position absorption. I'm predicting we will have a deficit of about $1.3 million at the end of this fiscal year. We're fortunate to have that reserve that can handle the deficit, but we can't handle it year after year, of course. Another thing to consider is, the state will return our 3% non-compliance withholding as we've demonstrated compliance, which is great. That was overall for the whole year, just under $1 million that they were going to withhold. Arizona lawmakers are required to increase school funding every year by the inflation rate, or 2%, whichever is less. However, there is a stipulation called the ADE appropriation percent trigger that states if the education budget reaches 49% of the total state budget, we would not receive an increase, and the budget could actually be reduced by the current year inflation. The education budget is estimated at 48.9% by the Joint Legislature Budget Committee. So we are very close to that 49%. So we will see what happens. Usually I think the 2% or the inflation they let us know by May, June?
Sometimes they don't pass the budget until July.
Yeah, so it could be a while to know if we are getting the 2% increase, which we generally have relied on, or if we're not, and possibly decrease. So that'll be fun for us to look forward to. That
So the bottom line great news is we have a reserve that
Yes.
came from all of the hard work the teams have done in the last 12
Yeah.
months. And then I'll give you that updated. I'll actually share with you the worksheet that we used by school. It's a workbook that has a worksheet by school so that you can see specifically school site by school site where the changes in population are and the changes in staffing might be, if you're curious. I just didn't want to have that because not all the conversations have occurred. I didn't want that in a public streamed meeting.
If there are any other questions that you guys think of over that you want to see by the next board meeting that I can help clarify anything, you can always email me and let me know so that I can get that for you.
Any other questions?
If not, I'll get a motion to adjourn.
I move that we adjourn.
Seconded.
All those in favor?
Aye.
Aye. Meeting adjourned.
Boyd?